students are less naughtier than what we were.
Sudhir has come in.
I have
Welcome,
no person
Sudhir.
to comment, but the number is 250. Number of students in each batch is 250.
Welcome,
250.
Sudhir.
they are increased
Welcome,
now.
Ravindra.
Yeah.
That's quite a huge number of students per batch to handle.
Yeah. That is the upper limit.
Upper limit. I remember we were 200.
Yeah.
Are you recording now, or is it that you're going to record it afterwards? Hi,
It's already
Sudhir.
started.
Start.
No, recording is started.
Recording
Yeah,
has
6 o'clock
started.
will start.
Hi, welcome. Vivek is here. Super.
Ram, I think.
Varun and Aditi can start.
Yeah, Ram, I think you take lead and start. Yeah.
No, Varun and Aditi, the students will come
Yes, sir.
in.
Yes, sir.
Okay, fine.
Yeah.
Yes, sir.
Hi, Manisha.
Good evening
Varun.
to everyone present here. The Dr.M.V.L.Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean CGS Medical College at KM Hospital, welcomes you to this session of reminiscence. I would request Bal sir to play the video.
Yes. It is the students, past and present, that make a college what it is. So, as our twin institutes move towards the centenary, we want to give a virtual platform to every batch of GSMC to share their fondest memories of college. Their thoughts and emotions will preserve forever in the form of these reminiscences.
So to remain connected to our alma mater and informed about the activities in KM, including its centenary celebration, we request you to become members of the Gosumec Alumni Association, the official alumni body at say GSMC. All the details and this membership form are available on KM website. I would request Bala sir to show the Gosumec Foundation slides. The Gosumec Foundation was established in California, United States, to give back to our alma mater, which has helped so many professionally and personally. The website allows you to enjoy nostalgic content, including history of our institution, medical humanities, archives, and much more. The first slide shows the web address, and at the footer of the website are links to social media accounts, including YouTube, from where you can access virtual reunions. The second slide shows the mission of Gosumec Foundation, which is connect, contribute with 3Ts, and engage. Connect global Gosumecs with our alma mater. Contribute to alma mater's development by sharing the 3Ts: time, talent, and treasure. Engage Gosumecs with a nostalgic media and enable global networking. The third slide shows how to access the Google form, which many of you may have filled already from the link which was circulated by a group lead. The data from the Google form says, the objective of this form is to connect with each other with the alma mater. Gosumec Alumni Association GA is the official alumni body at state GSMC and KMH. The information will be secure between GA and Gosumec Foundation and will later be used to create a secure searchable database. We're looking forward to Gosumec supporting our mission to connect, contribute, and engage. We now request sir to please take over the proceedings. Goodbye.
Ram, you can start now.
Yeah.
Yes, sir.
Shall I first project a slide? So, welcome all to this virtual reunion. GS 88 is famous for its reunions. You know, we have had at least 3 major reunions, many of whom couldn't actually participate, and therefore this virtual reunion is a boon for all those who couldn't directly participate in our physical reunions that we have conducted over a period of time. Now, before we start off anything, I would like to first acknowledge few things. Of course, we are grateful to the founders of St. GS Medical Foundation. The very reason why we are having these virtual reunions, I understand, is because of our centenary celebrations, which is going to come in, and we are planning to unite all the alumni of GS Medical College. And therefore, this institution, which the foundation for which is through sacrifices of so many people, I think we need to be grateful to the institution itself per se. Of course, I mean, our family, our parents have put in a lot of efforts to ensure that we are what we are. Our humble pranams to all of them, and of course, our teachers, support staffs, patients who have taught us what we know and what we are today, and to our seniors and colleagues who have shown us this path and helped us during crisis, has given the shoulder to bolster our confidence. Now, these student coordinators of GS Medical College, the present ones who are organizing these programs, are doing a very great job. And of course, Professor Natarajan, I don't know, I mean, I was by default the representative for this August group. And it is Dr. Natarajan's constant encouragement which has ensured that we come up to this place. Just to give us fair idea as to where we are between these 2 deans that we were inside the GS Medical College, and we represent the 200 odd students. We don't have the photographs of all of them, but we have many of them up there. And from this stage, we graduated to what we are at this point in time. My special thanks first to Dr. Samir Pradhan, Smriti, Sanjeevani, Priya, Pritesh, Mayuresh, Sujata, and Shobha, all of whom have significantly contributed to this virtual reunion as well as the reunions of the past. Just to give what we are looking at, our students, our batch is actually divided amongst all countries, occupying 58% of, we have 58% haven't left India as of now. And we have been contributing to the wellness of health in India. 20% of them are in America, whereas we have few others scattered all throughout the world. Unfortunately, one person is no more with us. So this was the first trip that we have had after we joined. This is our batch is supposed to be a fun-loving batch, which has also achieved many things and laurels in life with the blessings of God. We will have more of these things being spoken of as we go along. This is what we were during our first year, and slowly we graduated over a period of time for various reunions which happened in 2015, 2023, the last one being just a few weeks back. For the sake of everyone who hasn't been able to join, I'm just going to play a few clips from our last reunions. This is the reunion that we have had in the month of, in Goa. That's a welcome for all of us. So that's it as far as the first Goa is concerned. And this is one more clip of the same thing.
Ram, you aren't sharing anything. We can only see you. Ram, we aren't seeing anything.
Yes, please.
We can,
We aren't
after
seeing
the
anything.
first video, we cannot see your screen sharing. We can just see your face.
You're not able to see the video?
No, no.
Correct.
So what is it that we can do then?
It's okay. Play the next one.
Just check
Yeah,
with
I
the
mean,
tech
one of
support.
you have the video, right? Can you just play the video then?
No,
No, I think it's all
Badal,
right. I think we should move on.
Yeah,
Huh?
It's
yeah,
okay.
yeah. Agree.
I didn't get you.
Can we proceed?
We'll
Let's-
skip.
Yeah, we'll skip.
Yeah.
Yeah, okay, fine. So then we will skip the video part of it. And
hello,
you
Badal.
want all videos to be skipped, then what about the most recent
Can
one?
you try again? Sir, can you try again?
Yeah, I'll try the new one then.
Try the same one again.
The share
Share.
option.
Share the video.
So hold on. Share the screen.
Yep.
Yeah. Something is
Now
coming
it
up.
is. Now it will be seen. Yeah. Now play.
Yeah. Better?
Better.
The videos
Yes.
yet to come.
That's Ashwin's coffee.
Yeah.
Yeah, it was coffee that bound us this reunion.
That's it. And We miss Deepali Mistry a lot, who is no more with us. That's the only person that we know of who is not with us, and we pray for her a lot. So now we are going to start off with the list of people who are going to do their talking first. So let's start off with Alka. Alka, are you there? Hello.
Yeah, Ram.
Yeah, hold on. So, Alka, please.
Firstly, it's fantastic being part of this event today and all the reunions. I've managed to do a hat trick. So thanks to all of you who've organized. And I cannot say enough about all that I owe to KEM and GS Medical for the foundation and the huge network that I have managed to develop over the years. Just wanted to say thank you once again for all that you'll have contributed to, and you'll have really been part of everything that I have achieved. Thanks a lot. Thanks, Ramchandra.
That's fine, Alka. That's short and sweet. As you all know, Alka has been associated with many projects, and she is one of the persons who've been awarded the MBE, and she works a lot with regards to psychiatry and New Wales. Thank you, Alka. I mean, we'll get on to the next speaker now. Hello.
Yeah, we can hear you. Ram, did you name anyone?
Ami Masrani is here. She probably hasn't joined us yet. Okay, fine. Busare is here.
Yes.
Busari.
Yes.
Would you like to say a few things, Busari?
Yes. Yeah. Good evening, one and all. I'm very happy to be part of GS 88 team. And as I know, when we joined, we had a very good this thing. I remember still the memory of the first year of Dr.M.V.L.Kothari sir and Lupa Mehta madam. She concealed all us who were from Latur, who were from Marathi medium, and sir was very of opinion. You do not have to worry. With compassionately, he told that time, here when you have come to Mumbai, you have to have developed the habit of listening to English news, English watching English movies, reading English newspapers. So really, I still also I can't forget both of them who were our great mentors. And because of these inspiring and motivating teachers, as I am here today, what I am in front of you, and you can see few projects. And because of this humanity, I always believe in religion. Humanity is my religion, and I have been associated with Rotary for last 19 years, and I have been part of the various surgical missions. Maybe it's Republic of Malawi, it is Morina, Madhya Pradesh, it could be in Maharashtra, Udgir, and as well as one of the mission recently I had for 8 days in Anantnag district, Anantnag Medical College. So friends, it's a very good opportunity given by all of you, and we had a great 3 physical reunions done by a fantastic union by our organizing team. Thank you, everyone.
Thank you, Busari. That's wonderful. And we plan to have a different format, but then what happens is that since there are too many people who have joined, I think we ought to give an opportunity to everyone to talk. And therefore, I thought we will not use the format that we developed previously, but allow each one to do some amount of talking so that they can share their views first. And then if time permits, then we will go through the format that we decided previously. Okay, fine. So then this takes us to the next person. I think in the row will be our thrombectomy man, Dr. Dilip Yavgal, who's been, I first remember the meeting that I have had when he was standing for the post of the class representative, I think. That's the time when he came and approached me and we spoke for some time. And then from there, I see Dilip Yavgal as the thrombectomy man who's been promoting thrombectomy and stem cell therapy for stroke. Dr. Dilip Yavgal.
Thank you, Ram. That's a very kind introduction, and it's really no. I think more than what all of us have achieved, and frankly, seeing the achievements of each of us is both humbling and a source of pride, because luckily with social media we've been able to keep in touch the last 10 years, and I can say without a doubt that I've had the sense of accomplishment, not just with what some of the things I've been able to do, but each of us in GS88 have managed to achieve. And like some of you said, the foundation we got at GS with people like Manu Kothari and all our professors inspiring us to reach for the moon, and I should say, reach for the stars. It drove us to where we are today. I've had the great fortune of pursuing my passion for neurosciences, and with the right time and being in the right place, had the opportunity to develop a new field of stroke treatment called mechanical thrombectomy, which not because of me, but because of many pioneers, has become one of the top 5 most powerful treatments in all of medicine. So that's been my passion for the last 20 years, to get stroke patients from being paralyzed to being completely independent by accessing this therapy. And I continue to pursue newer therapies in stroke with stem cells given directly into the brain with neurointerventional approaches. So that's what I've been up to. But frankly, the fun is in seeing how all those black and white small faces have become the titans of medicine in each of our fields. So it's a tremendous sense of pride being part of this amazing class. Thank you, Ram. Thank you for organizing this.
Thank you very much, Dilip. Dr. Kiran, are you here? Kiran Matre? If Kiran isn't there, then maybe we will go to the next person. Komal, are you there? That's Komal. She takes care of research in Bhaktivedanta Hospital. Komal, are you there?
Ram, maybe you could take a minute describing the award that she just received. If you know the details.
Is it seen there? Are you able to see my screen there?
Yes, yes.
Wherein she is being awarded, I think it's the Best Physician Award for the best kind of social work that she has been doing from SAD.
No. She received an award for researching the mind and soul connection, apparently. Something related to that. So, it would be worth asking her to, share her
but Komal,
findings.
Komal is just coming into the room.
Okay, cool.
Komal, welcome, Komal. She's just joined again. Komal, are you there?
Yes. 1 second. Can you give me 5 minutes before somebody else can speak?
Okay. Then we'll go to the next person and then come back to you. Leena, ma'am. Leena, are you there? Hello?
Ram, can you change the slide?
Just a moment. It's taking some time.
Okay.
Leena.
Okay.
She there? She was there in the room. I saw her. Okay, Komal, I think it's better that you do the talking, and then subsequently we will bring in Leena here.
Oh, okay. Just this 1 second.
Yeah, no issues. Manisha, you want to come in? Manisha?
Okay.
Ram, should we just ask people who are seen on the video to speak first? Because I think too many gaps.
Ram, I'm ready. I can speak.
Komal, you are ready?
Yes.
Okay, then
Hello,
Komal,
everyone.
you start.
So happy to see.
Hi, Komal. Namaste.
Good evening, sir. Dr. Natarajan, sir, it is nice to see you after so many years. So Ram was asking me to remember some memories, and I was trying to recollect. And one thing which I remember was, I think the first week of dissection hall. And I remember when I entered, there was a person who would take attendance at the door. And he took the attendance, and then I went to the dead body, which, we were supposed to work upon. And somehow or other, I felt that the dead body's face looked exactly same as the person who was taking our attendance. and I was wondering, what's happening. And then it really stimulated me, that I was looking at him and I was looking at the face of this, gentleman who was lying down in front of us. And it really stimulated me, sir, to think that what is the difference between the living body and the dead body. And I remember our entire group. I think Kshama was there. I don't recollect. Shreyas was there, and few others. For next 2-3 days, we went to Mahalakshmi temple, Siddhivinayak temple, all the different temples. I don't know who else was there with us. And one more incident which I wanted to share was in the second year Cooper, the first day of emergency, very first emergency. So I remember it was evening after finishing the college. We went to the ward, and a patient walked in. Patient was walked in with snake bite. He was a farmer who had come, and he had snake bite. So I was just observing the nurses and the uh, seniors. I think they were junior and senior register. Everybody we were just, because second year first emergency, they have no idea, nothing. So we were just observing, and they looked at him. They took all the parameters, and then they gave anti-snake venom test dose. And we all observed what is the reaction. And patient, we waited, I think, for half an hour, and half an hour to 40 minutes. Nothing happened to the patient. So they started the drip of the antivenom, and they all went to the canteen. I said, now it is 4:30, 5 o'clock. So they all went to the canteen, and I was junior most. I was sitting there, just going through all the files. And suddenly, we saw that patient was very breathless. So the nurse called me. I said, I saying, just take his pulse, because that's the only thing I could do, pulse and BP. And I had patient's hand, and I was seeing his pulse. And in front of, I can say in my mind, I'm seeing the pulse. The patient had pulse, and then pulse disappeared. And patient, means we became, and by the time they called the registrars and everybody, they came within 5 minutes. And after 5 minutes, they declared the patient dead. The body was completely cold. And patient actually did not die because of the snake venom, because of the snake bite, but he died because of the reaction to snake venom, anti-venom. So that was very shocking to me. I was telling Ram, I don't remember many other things, but these two incidences, they gave such an impact in my mind at that time. And that feelings are still, I cannot forget, In the hand, the pulse was there. And because I was only on the pulse and taking BP, and how the hand actually became very cold, and how the soul just left. Patient became dead. So these are the few memories, which very strong memories. And I'm sure, I think others can talk, but I think 3 minutes are over.
Okay. The thing is that, I mean, we have even the other side of the story. We do have some pleasant memories of our ward days as well. When we were doing our first clinical posting, we had a patient with more than 3 months of fever, not diagnosed, with a massive splenomegaly. And there was no diagnosis. And as a junior, first posting, I was supposed to take care of that patient. And somehow in Matunga, we got a book, Atlas of Tropical Medicine. And then I used that book as well as our Golwala to find out why this patient was having a massive splenomegaly. And at that time, nobody knew about anything called as Kala Azar at that time. Okay, and that was the first time. I mean, during the ward rounds, I suggested Amit Vora was our registrar at that time. Kirti Patel was our honorary, as well as G.H. Tilve sir was the chief of the unit. And at that time, I suggested that it is potentially Kala Azar. And at that time, he never knew what Kala Azar was. And it was my first clinical posting as well. And then subsequently, what happened was it turned out to be the first case of Kala Azar in Bombay. And that is one of the vivid memories that I have, when Amit Vora actually sat down and we did all the Dharmendra tests and whatnot. And then antimony was obtained from one of those pharmacies, because it's not regularly available. And subsequent to that, I think Kala Azar was being diagnosed much faster than what it was previously. The differential diagnosis at that time was chronic malaria, whatnot, CML, everything was normal for that patient. 3 months, the patient was inside the hospital. So this is the other side of the story as far as our training is concerned. In the sense, I mean, both good and bad mixed together. Yeah.
I'll just
then it's
add,
a learning curve, what we should not be doing, isn't it?
I'll just add, Ram, that the impact of GS training continues, and in the context of Kala Azar, I think most of you may remember Abhay Satoskar. He's the leading researcher now in developing a vaccine for Kala Azar. He's conducting the first clinical trials in Africa. So yeah, there's definitely that's amazing that you diagnosed the first case there. That's amazing.
Yeah. Yeah. Great. Right. Next, Manisha.
Yeah, I'm here.
Would you like
Can
to
you
say a
hear
few
me?
things? Shall I share your slides?
Sure, sure.
That's you. You've been in India and you didn't, I mean, can you tell us more about it?
Yeah, so I just visited India, but I've been in US for last 25 years. I've been in Denver, Colorado, and I'm practicing medicine here in the community now. I used to practice as a faculty at the University of Colorado School of Medicine. I've been teaching medical students, residents for many, many years. But now I'm into holistic medicine and wellness. So I can really be at par with Komal. I understand what she went through with seeing the first death, which is very striking to all human beings. So I did a holistic wellness seminar for the Bruhan Maharashtra Mandal Adhiveshan that is there every 2 years in US, attended by about 5,000 people. So from that, what I thought about in GS was I did not realize at the time when I was in GS, but Dr.M.V.L.Kothari was teaching us medical humanities and ethics to us immature minds back in 1988. The medical knowledge, our thinking, advances, all those things can change. There can be cutting edge technologies that come and sometimes they go. But treating patients as people, these values of kindness, they remain, they persist. And Dr. M.L.K. in one of his lectures was quoting from Chandogya Upanishad that I am that. So मैं मरीज हूँ और मरीज ही doctor है. So there is only one. So I cherish the values that are carved on the pillar to the entrance to GS Medical College. To study the phenomena of disease without books is to sail an uncharted sea, while to study books without seeing patients is not going to the sea at all. So Dr. M.L.Kothari inculcated in me this angle of clinician wellness, to sing, to dance, to relax, and remain graceful, and just keep on going, irrespective of whether there are winds that are favorable or winds that are so harsh that they break and snap. But just keep going, keep helping people, and be kind. And I feel my alma mater, GS Medical College, and M.L.Kothari in particular, inculcated those values in me. And I remain truly grateful and proud of GS and all of you as my friends, colleagues, and my makers. Thank you, everyone.
Thank you, Manisha. That's nice. And Mayuresh, are you there? Would you like to say a few words?
Yeah, I'm there, but I think Ram, let the people who have not come for the reunion, they can go ahead.
Yeah, okay. Then I'll bring you at the end then.
Yeah.
Can I speak?
Right.
Can I speak?
Yes, of course. Who is that?
I'm Shobha.
Shobha, yeah, come now. I've got a lot
I'm
of
waiting
your
impatient.
clips. You want me to project them?
No, I don't want you to project any clip. I would like to
Oh, good.
introduce myself.
Okay.
I'm heading the Department of Psychiatry at Bhabha Atomic Research Center Hospital for the last 5 years. I've been working there for the last 23 years. I'm also a PG teacher. There are DNB students under me. That's about me. And I thought I was just reminiscing about the 5 years of hostel life. I'm going to take a little more time because there are a lot of gaps in between. And I'm going to take whoever has spoken less, I'm adding all that to my talk.
It's 15 minutes to go, okay? Shobha, just 15 minutes left. So be careful
Shobha, do you
about
want to, shall I put you at the end then? Okay.
Yeah, put it.
Justin, okay, learn to adapt to the diversities of the GS ecosystem. And I think hostel life has added immense value to the person that I became. And it threw open my world in a huge way. Sharing, caring, and bonding. And less of academics, but talk on all possible issues, including social and political issues. Who can forget the loud and booming voice of Jiza? I don't know if you all know Jiza. Shobha Nayan, tumsa phone call aahe. And she was the one whose voice echoed reverberated in the walls of girls' hostel as the only telephonic link in the evenings with family and the world outside. So I also remember very fondly our very old and bent Maushi who walked from Elphinstone station from wherever she stayed and tirelessly washed our clothes, often mounting her hard life while washing in the bathroom. And I feel a lot more gratitude to these two women who made life very easy for us hostelites. I remember the Dabbawalas who brought us Dabba on time. We were the privileged Bombayites, I mean far-flung suburbs, so we got the hostel on time, every time. And it also secretly carried allowances and messages from home. So we could share it with all my friends, the ones we remember. Third MBBS, the worst period of my life, felt like a rudderless boat, awed and intimidated by some professors and teachers. And some teachers became role models who I try to emulate. And I wish there was a little more guidance, a little more mentoring, and probably a little more hand-holding. Internship came in, and there were many a times when I was clueless, and I felt I need to do my third MBBS all over again. I haven't done enough to actually take care of patients, diagnose them, or even remember the doses of medications to be given. Internship also has left me with a lot of heart-wrenching memories of many incidents wherein we have lost patients before any medical care could be given. And that has angered me, made me feel helpless, and often wondered whether, the system could have been more accountable than leaving to immature PGs. I have triaged better. And I think these thoughts have actually made me a very sensitive person. It has made me develop much more empathy towards whoever may be the patient on the other side of the table, but more so for pushing to get the unmet healthcare needs of the stigmatized, vulnerable, mentally ill people that I cater to. I think these experiences also contributed to me taking up psychiatry. I would like to actually thank Dr. Vihang Maya's talks, lectures in 3rd MBBS, which were very inspiring. And I remember our clinic with Dr. S.R. Parker, where I remember Priya Jaydevan volunteering, and there was this, she had to enact a broken love affair and how the person is suicidal, and how with cognitive therapy, her mind just changed and she felt, no, I don't feel suicidal anymore. And I said, wow, this works. I mean, you can think differently and feel, and then be able to feel differently. And I also remember one patient who I had gone into depths of taking the history and knowing about a conversion or dissociative disorder, a young girl. And my batchmates were all like, I remember Jasmine and all, Ari, you are doing wonderful job. Yeah, psychiatry, you're doing so good. And all that led me to the intriguing branch of psychiatry. And I think that the lifelong friendships that I have made, the teachers who were role models, and some events during internship. Like we were a group of interns who had to face the outcome of the bomb blasts. And those were vivid images of what we saw in the casualty and around the casualty, still firmly etched in my mind. How helpless and how stupid I felt as an intern, not able to do anything. And but it is incredible that GS thought that we have to instill values of secularism and communal harmony in the hearts of the young medics. And I remember some of the faculty organizing a movie by the very acclaimed Anand Patwardhan, and we saw Ram Ke Naam in MLT. It was really inspiring. I think KEM also projected the social and political aspects of healthcare, and it widened my horizons, it widened my lens. And I feel I also got, got captivated by the talks of the then MAD leaders, Nagral and Yash Lokhandwala, who, and I joined them. I was a third MBBS student, and I remember climbing onto a truck and going to Azad Maidan or that Churchgate area where there was, and I think I was one of the leaders, women leaders, and during my PG in Nair, though I regretted all that after many years, when I felt that hospitals should never ever be closed down, and we cannot measure the impact that it has had on the poor in terms of access to healthcare during those times. And anyway, that's not any form of bringing about any change. So I think there were also some, I have also shared and felt the pain of many of my friends who got relegated to the so-called casual batch. And
Shobha, I
I
think you
have
got to
often
end in a
wondered,
minute or so
in another
because
10
we have,
seconds,
yeah.
I've often wondered how tough coping would have been for them. And I'm happy that I'm in touch with all of them, and happy to see their resilience and how they have moved on. So all in all, I want to say that I will forever remain a proud GSite, and best wishes to the coming generations of GSites.
Thank you, Shobha.
Thank
That's
you.
very nice. And that's very nice. I mean, you've summed up many things. Can we have Munira now?
Hi, good evening, Ram. Thank you. How are you?
I'm fine. Nice that you could join.
Yeah, I'm so happy and so grateful that I can be a part of this. Good evening, Natarajan sir. So nice to see you after so many years. So basically, I just want to relate my journey from GS to Dubai. And I still remember the first day when I stepped into the corridors of GS, and I was filled with awe and I would say pride. And I think that emotion still stands very true today for all of us. We are all still in awe and so proud to be GSites. I think all of you will agree on that. And, the 5 years of MBBS, the friendships that we forged, they are for a lifetime. When I attended the first reunion and the last one, and the gaps were 10 years and 30 years. Some of my friends we met after 30 years, but we didn't meet as doctors. We met as friends. We met as the young college going kids, I would say. And the years in between just vanished. We started enjoying and chatting and joking just the way we used to 35 years back. So that the experience that we had last week in the last reunion was a really memorable one. Just to share a very funny incident, actually. So I remember the first year when we entered college, and we were all told by all the seniors that do not expect to pass any exam. We had all come from we had all got admission into GS and obviously scored very high marks in our 12 standards. So we were not used to failing, but we were all prepared by our seniors that you will definitely, fail the first Viva. And I remember very clearly we had this biochemistry Viva. And, so I think I had studied a little extra hard because, for the fear of failing. And VC can vouch for that. I think he would remember that. I somehow managed to get full marks. And I was like very surprised. And the news somehow reached to some seniors. And a few of them came to talk to me. Are you the girl who got full marks, who passed her first Viva? And it was not a moment of pride. Actually, I was embarrassed by it. So I still remember that. And VC still teases me to this date about how I used to study like mad. We all used to, but yeah, we all had a share of enjoyment as well. I remember our first trip to AIMS and all of us singing in the bus, Niche something, no, Paan ki dukaan upar. I don't know what I don't remember that, but that was very that was a very enjoyable experience. And after
Niche
all,
Paan ki dukaan, upar Gauri ka makan.
Exactly.
It was Sham who started it.
Yes, that was
Yes,
Sham. That was Sham. Definitely. And then I remember, whenever we used to finish in the exam, all 50, 60 of us would go to to go and watch a movie in the theater together. So, these are some fun memories that I remember. At the moment now, I'm settled in Dubai. I am more into fertility practice, and I'm attached to a center called Born Hall Fertility Center. So that's the branch of the original Born Hall in UK, which was the pioneer of the first IVF baby. So I'm really proud to be associated with that, and I think GS has laid that foundation for all of us, and I will forever be grateful. One more thing I just want to say about our wonderful batchmates, that they are absolutely wonderful. Even if you haven't been in touch with them for many years, just a message or a phone call, and they are always ready to help us. So that's really amazing. And thank you to all, because we are not in India, we are far away, and it really means a lot when you go above and beyond to help your classmates. So thank you very much.
Great, thank you. It's been wonderful, the kind of bonding this batch has got within the groups as well as across the group is so great. And it's amazing. There must be some previous janam bonding that must be there, which makes us to continue with this sort of a bondage, Anyway, coming back is Murli here. Swati. Hello.
I'm there, Ram.
Yeah.
I'm there, Ram.
Yeah, please. Okay, Murli after that Swati. Okay, no problem.
Hi, Ram.
Hi.
Okay.
First of all, Ram, Jai Sri Ram. I just wanted to share very funny memories which I had with KM as a student. Then as an came out of it as a consultant. I was also associated with KM for a long period of time. My very interesting funny memories was because I'm coming from interior of Maharashtra. When I joined KM as a first year student, I still remember on the first day, the lecture was of Dr.M.V.L.Kothari sir. And I was carrying a lot of notebooks and I was trying to write what sir teaches us. So I was shocked to know that I could not understand any of his lecture in the first day. So it was quite tough. So for me, the challenge was initially to get accustomed to wavelength what Dr. Kothari sir talks and speaks. I think he is one of the most brilliant orator I have seen ever in a life. One of the brilliant, knowledgeable person. And even today also I feel that most of you could, you can understand his quotes also, which he used to write on the notice board. which I hardly used to understand in first few months. It was very difficult. Then Lopameta madam, when madam used to come for lecture of that embryology and genetics, it was so difficult for me to understand what is happening over there. But slowly I got used to it, and now I'm practicing as a geneticist in Mumbai as a pediatrician. But that was so interesting part for my evolution or journey and associated with the anatomy department and long association with Dr. Natarajan sir. Our human body has got 40,000 genes, but Dr. Natarajan must have got surely more than 1 lakh genes. He's a brilliant person. We know, sir, in anatomy department, whenever we used to go for his see him, sir, during our anatomy dissection, he used to be always on toes. From head fitness, suddenly he used to go lower extremities. I was there with sir as a lecturer at Department of KM. And to share you interesting fact that sir has never put a notice board of number of rooms which is allotted to individual PG student lecturers in his entire lifespan. He has never put any notice board. You tell me, Murli, 2006, 2004 and 5, you were sharing room number 5 with these 4 people. These 4 people have moved to other rooms. And now you have to share this room number 16 with for 20, 21, 22. He's a human genius, brilliant person with a memory of more than 10 TB in his brain. He's an amazing person. And biochemistry, the experience was also very interesting. We could first few days it was very difficult for us to understand those experiment which was going on. When we shifted to clinical side, a lot of interesting thing I used to as a hostel. I was staying in a hostel. I used to there is something called Khufia clinic. So we try and see that where is that Khufia clinic being held. So I remember attending Dr. Dilip Karnad's odd hour emergency rounds, Dr. Shennai's odd hour surgical clinics, and then we understand the meaning of Khufia clinic. My association with the first year was with most of the batchmates which are just surrounding to me. Not I was not generally vocal enough to reach to most of it. Most of our association was with the hostel mates like Busare, Birazdar. I could see Chokdar. Chokdar was my favorite friend, and every day in the night we used to roam around in around KM, and people used to wonder whether they will really pass or not third MBBS. Because every evening 8:30 to 9:30, myself and Chokdar used to be all going out, moving here and there. And interesting thing about KM is that the zeal for academics. So as I told you, I came from outside Mumbai, settled now in Mumbai, but the entire curriculum of academics has been shaped by KM. So whenever I go to another institution, I would say that I'm a UG from KM, then PG from JJ. So suddenly I went to JJ Hospital as a postgraduate in pediatric practice. So they would always look upon me as one of the brilliant students because we have been so thoroughly grilled by our teachers and especially the pediatric department. I become a pediatrician by my choice. I still remember to project the slides in pediatric debate when I was a monitor. And as you know, Aspirani madam, Kumta sir, they were one of the most talented peoples across. And how they would raise our bar. And they used to talk some difficult language which I hardly used to understand at that time as a normal UG student. But slowly, of course, over a period of time, we picked up all of them. So my association as a newcomer, I would say that if a person who doesn't belong to Mumbai comes to Mumbai as a first year student, I think it would take 1 to 2 months for him to understand what is being taught in anatomy, physiology, and biochemistry. Going to clinical branches, it is very difficult for us to get used to that particular format, understand what Kufia clinic means. And of course, the most of the support was from my friends who are there all in the group now. Dattatray, Birazdar, Usare, Vikram Medikar, who has become now dean. So all these to be strong support system. We used to enjoy together in hostel. We had a gala time and the sharing and basically being in a hostel, you try and understand what is the body language of each people and slowly evolve to you with the competition is there. And Ram, I still remember the tea and coffee. And if you remember, Ainapure sir had met us in that coffee when we met last time. And that was one of the very nice experience. If I remember it, I don't know whether you remember or not, but the coffee which we shared with Dr. Ainapure and the wonderful memories. And today, even I today also feel that Dr. Natarajan has more than 1 lakh genes in his body. He's a brilliant and genius person. I'm yet to see across a human being working like a computer with a huge TB, 10 tables by it, remembering everybody individual names across 15 years, across decades. He's the only person who has never put a schedule he used to remember schedule of 365 days of anatomy. He used to remember 365 days, all entire thing. And finally, the memories of Scorchy, Orgy, and the singing opportunity which I got by default because there are some lacunae there, so there are some people not there. So I enjoyed the thoroughly association. So my memories of KM are only the hilarious part and the wonderful journey, which was difficult initially, but become a smooth walk later on. Then I become lecturer, associate professor at KM. So I enjoyed my teaching profession over there. And overall, the journey was fantastic and brilliant. But of course, this was a niche, which was at 18 years of age as a student. And of course, Mayuresh remembers me how he used to teach me as a student in first year. And Pritesh Mistry also knows me. So, of course, this was some difficult tasks and difficult journeys. But overall, it was a fantastic thing. And I thank Dr. Natarajan sir for his brilliant person. I think again and again telling you, it's yet to see a genius like Dr. Natarajan. And thank you, Ram, for that wonderful coffee which you offered me almost 25 years of the life. Thank you. Thank you.
I don't remember any of those things. Anyway, I only remember that there were two people who have brilliant memories. Of course, Dr. Natarajan, you have a first-hand experience. The second experience is with Dr. Pradeep Vaidishwar. You know, even last time, before I came over to Bombay, I just gave him a call and he said, how is Rashida? How is Kamnesh? How is Priya? I said, how do you know them? By their role order, you know? That's how he called up each one. And he said, please convey my regards to all of them. You know, I mean, that's another person who have really shaped our lives, you know.
I think I can add to that and say I keep reminding him because I'm a pathologist. And whenever I meet him, I tell him that I am from Vidyadhar's batch, I'm from this batch. So he remembers our batch very, very thoroughly.
Correct. Swati, please come in and then Ritu will join you afterwards.
Yeah. So am I audible?
Yeah, you're fine.
Yeah. So very good evening from the cleanest city of India, that is Indore. And just like you all, I am a proud GSite. I would like to, I actually call GS group of institutions, including KEM, Vadia, Cooper, etc., as my professional Mahir, the Maika in Hindi. And I, just like in life, I have bittersweet memories of GS. So I was a bit lost when I joined GS in first MBBS as an all India candidate. 1 month after the localites had already settled into various groups. So my initial days of first MBBS were a bit. Hello?
Yeah, you're fine. You're audible.
My initial days of first MBBS were a bit. Right. So my initial days were a bit lonely till I met the non-Mumbaikar girls hostel gang and then went on to form lifelong friends from there. Now, talking about what inspired me to become who I am today, I would like to sum it up into 3 things. One is the great inspiring teachers and clinicians, about which I'll talk a bit in a moment. Second is the motivated captions and quotes, the one outside the library which Manisha referred to, by famous physicians of yesteryears like William Osler. My PG students, I teach in a medical college. I'm a professor of pediatrics, and they know me as a that I'm a fan of William Osler. So it all started in the from the caption that was there outside the library of ours. And last but not the least, I would like to also remember the most vulnerable, needy, poor, helpless patients who throng to our public hospitals in the hope of finding an ending to their suffering. And I remember many anecdotes of my first case of medicine, my family community medicine at BDD Chawls of Naigaon, and my cases that I saw in pediatrics. But for want of time, I would elaborate on them. I would like to mention especially some teachers who have had a deep impact on what I have become as a teacher, as a clinician, and as a person. And the one person that whose name comes to my mind is Dr. Sanjay Nagral. He was an excellent teacher, and I was very fortunate to be in his unit in surgery. And with his excellent clinical skills, his way of teaching, a very simple, unassuming personality, and an excellent empathetic communication with the patients. That is what motivated me to become a very sincere and a skilled physician. Later came my posting at Wadia, the pediatric posting at BJ Wadia Children's Hospital, and I was again fortunate there because I got to learn the basics of pediatrics in my UG days from the great teachers like Dr. Kumud Mehta, Dr. K.N. Shah, Dr. Umali, Dr. Surekha Rajadhaksha, Dr. Rashid Merchant, and that is where the roots of my love and passion for pediatrics and taking up it as a postgraduate started. What I wish was, see, everything is not good about whatever your experiences are. So what I wish was very different, or was a bit different from what it was in those years, was that I wish that there was no divide between suits and guards. That is the one thing that I wish was different. As we evolve, we all realize that, but back then it was a reality of GS. The second thing, as Shobha referred to, was a casual batch. I empathize and I really feel the pain what they must be going through, the ones who could not clear the MBBS exams the first attempt, and especially so because I'm a teacher right now and I see the same thing with students even now. And also the divide between the elite South Mumbai versus the rest of Maharashtra, that was there somewhere there in GS. So I wish these 2-3 things were different, and the experience in GS would have been much better. So that's what my
great. Okay. Actually, I mean, as far as my batch is concerned, I actually appreciate all my batchmates more so because they were so accommodative. I still remember when we went to the canteen and I accompanied them, all the people, actually, many of them who have bought non-veg didn't open their tiffin box, but ordered for their food. I was very amazed. I still recollect that memory, the way they were accommodative just because I was sitting. Well, I didn't have a problem with they eating it, but then that's how
The veg
accommodative
biryani,
people
Ram,
were.
the veg biryani which we would be ordered when we would be accompanying them. Remember
I
that?
was very
Yes,
surprised.
yes.
Anyway,
Yeah.
that's fine. Yes, Ritu, you can start.
Okay, hi. So I'm Ritu Kulshrestha. I was the roll number 4 of our batch. And I like to start with that day in 1988, which changed our lives forever. So I remember vividly that day. We were first called to Sion Hospital, where we were all had to fill out our forms and stuff. And then we had to go to KM Hospital to get our roll numbers over there. So it was a very excited batch of myself, and I'll speak on behalf of Dharni, Rashmi, Preeti, and all of us who went first 4 of us standing girls in line. And we got our, I hope your screen is being shared around because I can see you very clearly. So, okay, so I remember that day very clearly. And then we were allotted to, but to our great, later on we realized that we were allotted the first row, first 4 seats, which we had to continue for the next 1.5 years. Anyway, the lectures were amazing. The foundation of basic sciences and medical sciences, and especially Dr. Manu Kothari's philosophy of medicine, which he taught us. Not only medicine, but the philosophy of it, which he was able to convey to 17-year-olds who were so fresh with bright ideas, and that was something he was able to connect to all of us, is something which I am always grateful to him. He had hundreds and thousands of students, but towards a few months, he realized that there were 3 Ritus in our batch. And so to identify that, such a personal touch, he would call us by our surnames, Kulshrestha, Chabra, and Ghai, because he knew that there were 3 Ritus in the batch. And in 2006, somehow I sneaked into one of his lectures, which was ongoing, and I went purposely to the last bench, and I heard a portion of 15 minutes of his talk again. I think that was the most amazing thing which I must have done. Apart from that, my time at GS Medical College was spent in the canteen, in the library, in the ladies' common room. It was an amazing experience. I went back to see it, I think 2009 or 10 again, when I was called for a lecture in the MLT. It gave me goosebumps to be standing and talking over there as a faculty. And Dr. Pradeep Vedeshwar from pathology, as I mentioned, is a great mentor. I meet him in many events and try and translate all that the meticulousness and the hard, work which we now understand as heads of departments, and how much of work has gone into training us, and all that, those hours and hours of, lab work and theory, all that which has been, given to us, is a gift which I appreciate. I also like to acknowledge the helpfulness of this batch. I mean, any problem anywhere across the world, you just write to them, and you, within hours, you will get a reply back from the best in the field. And I would like to proudly say that the cry which is there, who are we GSites? I think our who are we GSites is what I'd like to end this. Thank you so
Great.
much.
Great.
Yeah, thank you. Yeah,
Thank you, Ritu. Dr. Sudhir, would you like to take us through your journey from a student to a dean? Dr. Sudhir Medekar?
Dr. Sudhir, you're muted, I think.
Okay. Maybe you want to speak, Rashmi?
Oh, I was not in the list, and but I'm
you're
so
on the
happy.
screen now.
Yes, but I'm so happy to see all of you, and I really apologize for not being in touch. Yeah, I somehow lost touch. So just to let you know, yeah, I am a proud GSite, and I'm a proud GS88ite. I think my undergraduate days, somehow my memory is not so great, but what I remember was having a lot of fun. Yeah. And the second thing what I remember was somehow our batch was very resilient. Anything happens, good, bad, we always found a way out. And we always did it with a lot of fun and with smiles on our face. And we were cheeky and we were troublemakers. But it was such a wonderful journey for me. At the same time, I was always helped, as you all say, always with all my colleagues. And I remember with fond memories, my first 4 batchmates, as Ritu just pointed out, because we used to sit in the first row and couldn't really do anything but listen.
Yeah.
But even in second and third MBBS, it was a lot of fun. Okay, so I finished in GS and I went on to do pediatrics in JJ under Dr. Ambedkar, whom I suppose some of you might know. And the zeal to do my best, to really pay attention to details, to work hard, I think came from my formative undergraduate years. Subsequently, I came to Singapore actually, and I became a neonatologist. And then I went to Germany, where I unfortunately lost contact with many people. And I was there for 15 years. Did quite a bit of research in neonatology, published a few papers as well, animal research, as well as, if any of you are neonatologists, did a study in neonatal hypothermia. Then I'm back to Singapore since 2017. And now I'm doing developmental pediatrics. So I'm basically following up children. Yeah.
Super. Thank you. Thank you, Lakshmi, for the introduction and for letting us know what you're doing at the moment. This is the only way by which we can connect to you, I presume. Well, from now on, Samir will be there to follow you up.
Thank you very much.
Yeah, welcome. Dr. Sudhir, please.
Yes, Ram. Can you hear me?
Yes.
Hi, everybody. I joined.
Can you put your video on so that we can see your face? It's okay. At least do the talking.
Yes, yes.
That's great. Welcome.
From 88 to 97, I was in GS Medical College, KM Hospital. And after that, I joined JJ. And after that, I gone to rural sites and other districts of this Maharashtra. So KM, GS Medical College has very important role in my life because I learn many things from the teacher, from our work environment. I learn about the sincerity, integrity of our teachers, GS Medical College, the work environment, and the resilience we got from the KM culture, which has given very important aspect in our life. Then I completed my dermatology from KM Hospital. Then I came to JJ Hospital, Grand Medical College. After that, I gone to the Dhule, is one of the rural side. Then Aurangabad. And it's like a ghar wapsi to be. Again, I came after recently within 5 months, I came again to Nair Hospital into BMC, is the one of the MCGM part. So it's a very great, it's a great pleasure to come back to MCGM Municipal Hospitals. And thank you very much. It's a good environment. We got it, and it's a pride moment for us to be united again. And this is my first appearance to our batch to meet you again, 88 batch. It's a really great moment. Thank you.
Thank you very much, Dr. Sudhir. And actually, we have lot of expectations from you. The various changes, the various shortcomings, all these people are talking about. I think you are the one who can potentially help get over all of them. Okay. And we are here to help you out in whatever manner possible. Thank you very much. Congratulations and all the very best for all your future endeavors.
Thank you, Ram. Thank you. Thank you.
Dr. Supriya, please.
Yeah, hi, can you hear me?
Yes.
Yeah,
and now
good
it's
evening.
dinner time, and now Supriya is going to host us.
Yeah, yes, sure. I think I'm being one of those fortunate ones who's just going to have Dr. Natarajan because I can see his message that we are going to soon end the meeting at 7:30. So good evening, sir. I've been a fan of you right when I was in GS 1988 until today. The amount of work you're doing on Gosumec is just awesome. I think there's no other word for that. And thank you so much for that. Regarding me, I don't think most of you know who I am. So let me start by, I'll be very quick. I'll finish in 2 minutes. I'm Supriya Shetty, of course, in the 88 batch. And I have unfortunately not attended any of the reunions for whatever reasons. For the current one, I just missed it because I was in India just a week before. I am currently working as a consultant in histopathology, which is not what I did when I was in KM. I did dermatology under the guidance of Dr. Rui Fernandez, and I owe a lot to him. But unfortunately, when I came to this country, I changed my field to pathology, and I'm currently quite happy to be a pathologist. And this country gave me an opportunity to change into my hobbies, and I'm currently a lot into cooking, creative cooking, running for charities, generating money through my cooking. So I'm doing a lot of other things apart from medicine, which I'm sure it's unlike GS 88 batch. But I'm so proud of all of you and what all you all have achieved. And Ram, thank you so much for being such a good host and trying to be patient with so many of us, I think. I echo what Shobha had said in a lot of things. And she took us back to the hostel days, to which I owe a lot. And thank you, everybody. And I'm really very proud to be a GS site. Thank you.
So, Supriya, where are you in the world?
Oh, yes, sorry. I'm currently in the Northeast England. So I work for the failing NHS. Sorry, Alka, if you're still listening, or whoever is in UK. But yes, I'm in UK now, Northeast England, which is very close to Scotland. So I'm about 1.5 hours from Scotland. Anybody who decides to visit this part, most welcome to come and stay with me. And I think some people were talking about the way we were trained. And my daughter is in Imperial doing 4th year medicine. I can see the vast difference in the training, what we receive and what she's receiving. I think I'm practically living my GS life when I'm seeing her training. But I just wish, I think what Swati had pointed out, the way we were trained would have been slightly different. I'm sure it would have helped me at least, definitely. But again, once again, I owe whatever today I am to my parent institute, KM. And I thank all my teachers, and I really thank for Dr. Natarajan and Ram for having this meeting, and of course, Sami Pradhan for taking all initiatives for the reunions. And Thank you, everybody. And it was so good to see all of you all. I've seen only on you on Facebook or on social medias, but it's nice to see when those photos start talking as well, I think so. So thank you so much.
Yeah. You're most
Supriya,
welcome.
sorry to interrupt. Supriya, you were there for the girls' reunion. You forgot. December 2017.
Yes, I was. Yes. And I think it was me who actually initiated it, though Shobha did all the hard work.
Yeah,
and yes,
and you forgot about it.
Yes, no, and yes, I forgot about that. It was a girls only
We were
reunion.
27.
It was in 2017. Sorry, I'm getting old now, so I can't forget.
So Priya, we try to follow your recipes, but being two thumbs, nothing works. So you need to maybe guide us more.
You all have to come over to my house, and I can host all of you. I promise.
So our next reunion is supposed to be in US. They've already started planning up there. So I think we now have a good host as well in terms of the food part of it is taken care of.
Yes, amazing recipes which you puts up on Facebook. Amazing. They're amazing to, can't follow them, but.
Yeah, I think I'm better known here as a cook than as a doctor, I think. I'm sorry to say. The GSKM will not be very happy we are listening to this, but I think my training in medicine is helping me towards healthy cooking. That's what I'm promoting, I think. And I'm generating funds through that and through my walking, which I really enjoy, and trekking. And I'm pushing that into my hospital charity and few charities in India as well. And I think I'm quite happy to be doing this. It's sort of hard work, but that gives me the happiness. And really so happy to see all of you. Really happy. And I can see there are only 34 participants, and initially there were 42, but very, very happy to see everybody. And thank you, Ram, again, once more. Thank you.
You're most welcome. You're most welcome. And we are very, very happy that you find time to participate. That's the most important thing. Is there anyone whom I have missed now?
Can we have a few words from Dr. Natarajan?
No, Ram.
Yes.
No, there are just 5 more minutes, so just utilize it.
We will wrap up, sir. Any moment you want us to wrap up, we will wrap up. There are many, many things that we can potentially talk about, but we can wrap up at any second now. Just to give people who haven't had the opportunity to talk. Sanjeevani, come in. Welcome.
Yes. Extremely
you want
sorry
me to project your items?
Sorry?
Do you want me to project all your photos?
Hello.
No. I think they have been projected enough on the group now. So I just wanted to say that I think we couldn't have been more blessed than to be in GS, and with this wonderful group of batchmates that I have, I think I couldn't have been blessed more than this. So I thank all of you for being with me in my journey, and I'm really so blessed to have all of you with me. And what GS has given to all of us, I think, is remarkable. What ethics we learned there, the teachers that we had, and what we have carried. I just wish, that we could just carry this tradition of GSMC and this whole, whatever tradition, whatever values that this place has given us, if we can even carry a bit of that with us forward, that would be something really nice. And I really look forward that if there's anything in my small capacity that I can do to make my GS flag fly high, I'm always there. So please count me in for anything of that sort. And thank you very much for this little opportunity, and thanks for having this Gosumec reunion online. So I don't think I want to say something more. I think anyone else who wants to add, please do it.
Yeah, just
can I just have 2 minutes?
Plus. You want to say something or yeah.
Yeah, so I'm in a car traveling, so I'll just have to say two words, not much. The best part of our batch, besides means all the batches are having intelligent quotient, financial quotient, but the emotional quotient and the social quotient of our batch is unparalleled. And exactly 1 year back when I had a major surgery, the emotional quotient I felt it was very obvious. All of them were praying for my safe surgery and my recovery. And I was very confident of my batchmate and my dissection partner. I decided to go through under his knife. And now, after that, I connected socially with a lot of batchmates. And the result was there last week, where we had a tremendous response for our reunion, which the third reunion, in fact. So that is what our GS 88 batch is. As Priya calls it, it's a slightly hatke batch. And we are there for each other. And thank you very much for having us together. Thank you.
Thank you very much. Thank you. I mean, that's well said, and that's well ended as well. Just to say the relationship that we have been having with regards to, just to put things on record, nothing more than that. The GS88 badge with regards to KM Hospital and Cooper, the thing is that we have instituted this endowment for an annual donation in Humanities, and few of our batchmates got together and they built this, they redid the interns' quarters at Kamam. And that's what it is. And this is the feedback that we got from the students. And lot more to be said, but then I think on record, I think since the time is up, I think we'll stop here. Thank you, sir, for having given us all this opportunity. And we are all blessed to have teachers like you, because of whom we are what we are at this point in time. I still vividly remember the kind, your room was next to Dr. J.L. Shah's room, which I used to visit many times, and I used to envy you whenever I see you, the kind of memory and the way you used to teach us, and we are trying to follow 1% of what you have taught us. Maybe our students are not as gifted as we are, but definitely people like Dr. Natarajan, it's damn very difficult to find in this world. Pradeep Vaidishwar is the other person, and I think we really enjoyed our life in GS. Thank you very much. It's 7:30 and we end it here.
Yeah.
Is there anything anybody else wants to talk?
No.
Sir,
We would like to hear from sir.
Yeah.
One last concluding word from sir.
No, this was a program of 88 batch, for 88 batch, by 88 batch. Okay,
Who was the naughtiest?
Oh, no, there's nothing like naughty. We all are. All batches are. So now the video is being shared by the students and they'll have a vote of thanks. Okay, after that we'll deal it.
I think we should end with Kamlesh saying, "Jab koi baat bigad jaye." That is the most apt to describe our batch, that we stand for each other in happy and sad times together. So I think,
Kamlesh, please welcome.
Kamlesh, where are you?
Let's finish the presentation, I think.
It's done, I think. Ram, some presentation, are we ending with Kamlesh?
To speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari, Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. GS Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. Issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021,
Kamlesh, maybe you can override this presentation and talk.
COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. GS Medical College and KEM Hospital, who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was Literature and Medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to the theme. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. GS Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us, the readers of the book. We, as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much. A very good evening.
We'd like to thank our Dean, Dr. Sangeeta Rawat Madam, and Academic Dean, Dr. Pathak, for the continuous support and encouragement. We thank the Gosumec Alumni Association for administrative support for correspondence and financial transactions of Dr. M.V.L.Kothari, Chair and Division of Medical Humanities. We thank Mr. Tushar and Mr. Badal for audiovisual and technical support, Dr. Mehtre for video recordings. Last but not the least, a big thank you to the batch for the enthusiastic participation.
Kamlesh, now you can come out with your song, please.
Thank you. And just wanted to say, hello, can you hear me?
Yeah, we can hear you.
Okay. Just wanted to say that it's such a privilege to be part of this group. And even though we are meeting after 30 some years, we can chat like we met 30 days ago. So that's really the amazing part of what we are. So I'll just say, ना कोई है ना कोई था जिंदगी में तुम्हारे सिवा, तुम देना साथ मेरा ओ हम नवाज। जब कोई बात बिगड़ जाए, जब कोई मुश्किल पड़ जाए, तुम देना साथ मेरा ओ हम नवाज। Everybody can join. जब कोई बात बिगड़ जाए, जब कोई मुश्किल पड़ जाए, तुम देना साथ मेरा ओ हम नवाज। Thank you.
Thank you.
Thank you very much.
Barbel, now you can stop the recording. And yeah.
So we need to hear a few words from you.
Yes, sir. Now it's off the record. Now you can talk with us.